Hi everyone, this video of mine is a continuation of my last video regarding fevers, and I will discuss preventive measures and diagnosis and treatment of fevers in this video. So let's start. Well, you may be able to prevent fevers by reducing exposure to infectious diseases. The tips I am going to tell you should follow. The first thing is you should get vaccinated as recommended for infectious diseases such as influenza and COVID-19. Then you should follow public health guidelines for wearing masks and social distancing. The next tip is that you should wash your hands often and teach your children to do the same, especially before eating, after using the toilet, after spending time in a crowd or around someone who is sick, after petting animals, and during travel on public transportation. Show your children how to wash their hands thoroughly, covering both the front and back of each hand with soap and rinsing completely under running water. Carry hand sanitizer with you for times when you do not have access to soap and water. Try to avoid touching your nose, mouth, or eyes, as these are the main ways that viruses and bacteria can enter your body and cause infection. Cover your mouth when you cough and your nose when you sneeze, and teach your children to do the same. Whenever possible, turn away from others and cough or sneeze into your elbow to avoid passing germs along to them. Avoid sharing cups, water bottles, and utensils with your child or children. Okay, now coming to the diagnosis. To evaluate a fever, your care provider may ask questions about your symptoms and medical history, perform a physical exam, take nasal or throat sample to test for respiratory infections, order tests such as blood tests or a chest x-ray as needed based on your medical history and physical exam. Because a fever can indicate a serious illness in a young infant, especially 2 months of age or younger, your baby might be admitted to the hospital for testing and treatment. Now I'll talk about fever of unknown origin. When a fever lasts for more than 3 weeks, constantly or on several occasions, and there is no clear cause, it is usually called a fever of unknown origin. In these cases, you may need to see specialists in one or more medical fields for further evaluation and test. Okay, now I'll discuss the treatment. For a low-grade fever, your care provider may not recommend taking medication to lower your body temperature. These minor fevers may be helpful in reducing the number of microbes causing your illness. Fever above 102 degree Fahrenheit, 38.9 degrees centigrade, tend to cause discomfort and often require treatment. Now let's talk about some over-the-counter medications for fever. In the case of a high fever or a fever that causes discomfort, your care provider may recommend non-prescription medications such as acetaminophen, that is Tylenol, or ibuprofen. Use these medications according to the label instruction or as recommended by your healthcare provider. Be careful not to take too much. High doses or long-term use of acetaminophen or ibuprofen may cause liver or kidney damage, and acute overdoses can be fatal. Do not give aspirin to children because it may trigger a rare but potentially fatal disorder known as Reye's syndrome. These medications will usually lower your temperature, but you may still have a mild fever. It may take 1 to 2 hours for the medication to work. Call your care provider if your fever does not improve even after taking medications. And I'll talk about prescription medications. Your healthcare provider may prescribe other medication based on the cause of your illness. Treating the underlying cause may lessen signs and symptoms, including fever. Let's talk about treatment of infants. Infants, especially those younger than 2 months old, might need to be admitted to the hospital for testing and treatment. In babies this young, a fever could indicate a serious infection that requires intravenous medication and around-the-clock monitoring. Okay, now I'll let you know about some lifestyle and home remedies. You can try a number of things to make yourself or your child more comfortable during a fever. Drink plenty of fluids. Drinking fluid will improve heat loss from the skin and replace water loss through sweating. Water and clear broth are healthy choices. Infants under 6 months old should only have breast milk or formula. Rest. You need rest to recover, and activity can raise your body temperature. Stay cool. If you are not shivering, dress in light clothing, keep the room temperature cool, and sleep with only a sheet or light blanket. Okay, so this was my video about fever, and today this topic is completed. I hope you like this video. If you have any question about fever, please let me know in the comment section, and as soon as I find a time, I'll try to reply to your comments immediately. Thanks for watching this video. See you in the next video. Bye for now.